Welcome to PAM Health Rehabilitation Hospital. We are at their New Albany location today, and I am joined by Megan Gonzalez. You are a physical therapist, and Nikki Norris, she's an occupational therapist. Thanks for joining us today.
Thank you.
So, Megan, I want to start with you because rehabilitation is always evolving. And so why is lifelong learning just so important to therapists who want to provide the best care there is?
Well, as medicine changes, as life changes, as people's goals change, I mean, it's up to us to learn as many possible interventions for our patients. I love to learn. We all learn from each other, and I think that just makes us better therapists and obtain better outcomes every day.
Absolutely. And there are like new devices that you're using. There's always a chance to get out there and learn. And so you both work with patients during the most important parts of their recovery. So how does that really continuing to learn new methods, new ways really help that patient's outcome?
Well, without learning, there's no growth. And so, you learn, sometimes you learn with your patient. And the techniques that you learn from watching your patient do other things. Self-feeding, how to shape a spoon so they can feed themselves, which increases their quality of life, independence, and gives back part of their identity.
And I think really catering to that patient too, because I mean, you're gonna serve someone different if they're, a young child, maybe a teen, than you are like the elderly community. So I think having them at the center of and at the forefront of the care is gonna make all the difference. And so physical therapy and occupational therapy really work hand in hand. So how do you really work on that collaboration during this process?
So one of the best things here at PAM is our team. We communicate with each other every day. We go back and forth with patients, especially if there's something that our occupational therapist sees that maybe we don't see during our physical therapy sessions, or if there's a goal where we can work on certain things to help those improve. If there's a device, for instance, that they're using in their sessions they want us to use with them, we can take that in our sessions and have some carryover throughout their entire stay.
And like we mentioned, I mean, throughout this whole entire segment, we're talking about new techniques that you're learning. So what are some new things that you've really implemented in your care?
Oh, gosh, we do so many different things here. We've had a new amputee recently. That's been interesting, just watching through that, and he has an electronic limb. And I've spent a lot of time being interested in watching what you've done with that patient, and then watching how each therapist uses what we call therapeutic use of self, so you can help to identify with the patient what they're going through and use your personality to help them to not be scared to try new things and just develop rapport and trust.
Recovery can be so scary. I mean, whether you're coming out of surgery, maybe you're recovering from an illness or an injury. I mean, that's the last thing you want is like go to PT every day, right? And so how do you make that really comfortable for the patients?
One of our biggest things is we look to figure out what their goals are. And so we want them to make sure they know they're working for something and that their care is personalized towards what they want to get out of it. And again, like I mentioned before with our team, they know that we are all working together towards that one goal. And we're not just here for us, we're here for them.
It's so hard to kind of recover from that injury. Maybe, they're waiting and like, oh, am I ever gonna get back to normal again? What would you say really makes PAM Health different from other like physical therapy and occupational therapies in the area?
We all work really well together as a team. We communicate daily on everything, really. And the nurses here are always wanting to hear what we have to say. And then PT and OT speech, we all speak to each other. We have what we call IDT meetings, interdisciplinary team meetings, and everybody is involved in the care. So it's very cohesive, and we all know what's happening. You don't have to wonder. And that's how you know the next best step to take for your patient to get them home.
I think communication is so important when it comes to something like this because, I mean, you're going to spend a lot of time with that patient and getting to know them and really getting them back to where they once were. So thank you so much for having us out today.
Thank you very much.
So again, to learn more, just head over to pamhealth.com.